Welcome to today's lecture on the comprehensive overview of hypoplastic left heart syndrome, HLHS, a complex congenital heart defect. In this lecture, we will delve into the pathophysiology, diagnostic approaches, surgical management options, optimization of cardiac function, postoperative care, genetic factors, neurodevelopmental outcomes, palliative procedures, long-term outcomes and quality of life, challenges in transplantation, and the role of imaging techniques in diagnosing and monitoring HLHS. Hypoplastic left heart syndrome is a rare congenital heart defect characterized by underdevelopment of the left side of the heart, including the mitral valve, left ventricle, and aortic valve. This results in severe obstruction of blood flow from the left side of the heart to the rest of the body. The pathophysiology of HLHS involves a complex interplay of genetic, cellular, and environmental factors. Understanding these underlying mechanisms is crucial for identifying potential therapeutic targets. Early and accurate diagnosis of HLHS during pregnancy is essential for informed decision-making and optimal management. Various prenatal diagnostic techniques, such as fetal echocardiography and fetal MRI, play a pivotal role in identifying HLHS and assessing its severity. However, challenges, including limited access to specialized centers and the need for skilled imaging personnel, exist in providing timely and accurate prenatal counseling for families facing the possibility of having a baby with HLHS. The Stage I Norwood procedure is the initial surgery for HLHS. It involves using the right ventricle to create a new circulation and is done soon after birth. Understanding the procedure and its potential complications is crucial for better outcomes, and hybrid procedures are being researched to enhance patient outcomes. Hemodynamic optimization plays a crucial role in improving outcomes and minimizing complications in HLHS patients. Strategies such as maintaining adequate preload, optimizing afterload, and maximizing contractility are employed to promote optimal cardiac function and circulation. These approaches, along with the use of vasoactive medications and mechanical support devices, are tailored to the unique physiology and anatomy of HLHS patients. Close monitoring and meticulous titration of therapies are integral components of managing these complex cases. Postoperative care following the initial surgical intervention for HLHS is multifaceted and requires close surveillance. Complications such as cardiac arrhythmias, respiratory distress, low cardiac output syndrome, infections, and thromboembolic events can occur and necessitate prompt recognition and management. Comprehensive postoperative care strategies including adequate pain control, early mobilization, and appropriate nutrition support are essential for minimizing complications and optimizing long-term outcomes. In recent years, there has been increasing interest in the role of percutaneous interventions in the management of HLHS. Catheter-based procedures, such as balloon atrial septostomy, stent placement, and valve interventions, aim to alleviate obstruction, improve hemodynamics, and delay or avoid surgical interventions. However, the selection of patients, procedural risks, and long-term outcomes require careful consideration. Ongoing research and advancements in percutaneous interventions offer promising options for select HLHS patients. Genetic factors are believed to play a significant role in the development of HLHS. Various genetic abnormalities, including chromosomal abnormalities, single gene mutations, and copy number variations, have been identified in association with HLHS. Understanding the genetic basis of HLHS not only provides insights into its pathogenesis but also opens avenues for familial screening and counseling. Identifying high-risk individuals may help in comprehensive management and early intervention. Neurodevelopmental impairments are commonly observed in children with HLHS, potentially impacting their cognitive, motor, and behavioral functions. Multiple factors, including prenatal factors, perioperative events, and the presence of comorbidities, contribute to the increased risk of neurodevelopmental delays. Early identification, interdisciplinary assessment, and targeted interventions play a crucial role in mitigating the long-term impact on these children's quality of life and academic performance. Palliative procedures, such as the modified Blalock-Taussig shunt and bidirectional Glenn procedure, are employed as bridging strategies before definitive surgical interventions in select HLHS patients. These procedures aim to improve oxygen saturation, alleviate symptoms, and optimize growth and development. However, challenges related to timing, patient selection, and long-term outcomes persist. Ongoing research and refinement of surgical techniques are required to optimize outcomes in this challenging patient population. Survivors of HLHS face unique challenges throughout their lives, including the risk of cardiac sequelae, neurodevelopmental disabilities, psychological well-being, and overall quality of life. A comprehensive and multidisciplinary approach, which includes cardiac surveillance, psychosocial support, neurodevelopmental follow-up, and transition to adult care, is essential in promoting long-term well-being and addressing the evolving needs of HLHS survivors. Heart transplantation remains the ultimate treatment option for certain HLHS patients with a poor prognosis. However, bridging these patients to transplantation poses numerous challenges, including the need for temporary mechanical circulatory support, limited availability of donor organs, and immunological considerations. Optimal patient selection, diligent management of complications, and coordination between the surgical and transplant teams are vital in maximizing successful outcomes in this highly complex subset of patients. Imaging techniques, such as echocardiography and MRI, play a pivotal role in the diagnosis, preoperative planning, and postoperative assessment of HLHS. Echocardiography offers real-time assessment of intracardiac anatomy and function, while MRI provides detailed information about coronary artery origins, cardiac volumes, and tissue characterization. A multidimensional approach combining these imaging modalities facilitates accurate diagnosis, surgical planning, and long-term monitoring of HLHS patients. Hypoplastic left heart syndrome is a complex condition requiring a multidisciplinary approach and up-to-date knowledge. Advances in genetics, surgery, imaging, and postoperative care are crucial for improving outcomes and quality of life in these patients.